Hey, it's Jessica DaMassa with WTF Health. I'm here at HIMSS 19, and joining me right now, I have my two favorite guys from Livongo. We've got Glen Tullman, the executive chairman, new role there, and we've got this new guy. We've got Zane Burke, who's the new chief executive officer. So Zane, welcome.
Thank you so much.
And Glen, always good to see you.
Great to see you.
All right, so we're going to talk about all the new and shiny things you have going on there, and let's start with this one. So you've gone back to the old competitors and have managed to delicately secure talent. Is that the way we're phrasing it?
That's right. Well, look, we were fortunate to build a really important part of the healthcare infrastructure in the electronic health record space. And to do that, you need a lot of talented people. Yeah. So we respected, Zane and I were friends, but healthy competitors for a long time.
True.
And but I respected what he built at Cerner.
Awesome.
And built a great company. And so when the opportunity came to first become a customer of Livongo, which he did, and we had great results there, and we worked together even more, and I said, first and foremost, I like this guy. And second, he'd be a brilliant choice to come and run and help us build our business. And so here he is as CEO.
I mean, truly, you could not have found somebody who's got so much industry knowledge. I mean, it's actually interesting standing here with the two of you. I mean, those who are watching can't see this, but it's like people are doing double takes, like walking by. Like I have a lot of EMR firepower right here. You're lucky people aren't screaming interoperability at you as this is happening. All right, so Zane, I want to ask
you. If it was up to us, that would have been solved already.
A long time ago.
Well, you heard it here. That's your next venture is a new EMR company, right? Anyway, I want to talk to you, Zane. So welcome to your new role. What do you got on your docket? What's coming up? What are you doing? I mean, this guy set you up pretty well here. I want to get to the MyStrength acquisition that happened before you came on board, right? I want to get to that, but before I do, I just want to talk to you real quick about what you've got planned for this year so far.
Well, I appreciate that, Jessica. It's great to be here and be part of the Livongo team, and it's a great full team. So Glen's fantastic, but the broader team was amazing. And so the team itself is really poised for growth and to scale. And that's part of what my obligation is to really figure out how to grow and scale the company and complete the condition sets out, because there are many people that are suffering from chronic conditions, and healthcare as it exists today doesn't really solve their problems.
Also not interoperable, right? So I want to talk about how you guys are building this platform, because where you guys have started out, I mean, you kind of nailed diabetes now. You got a lock on how to do that. And now you're adding other things to it, and you're building a platform, which is like everybody I talk to in the industry, investors, the big health systems, the insurance companies, they're all talking about no more do they want a one-trick pony, they want a platform. And so you guys are doing this. You started out now by branching out of diabetes and into behavioral health, especially with the MyStrength acquisition. Talk to me a little bit about that. I mean, what else are you guys hoping to gain by building that into the platform now?
Sure. Well, first we should say that we started in diabetes, but very quickly we understood that 70% of the people with diabetes also have hypertension, high blood pressure. And so that was the first place, and that was internally developed, and we developed that. Then we understood that a lot of those people were struggling with weight issues. So our first acquisition was Retrofit, which had great product offerings in weight management and also in diabetes prevention.
Right.
And then came behavioral health, and it's something that Zane and I did discuss before he came on, so it wasn't a complete surprise. He was involved.
Surprise, you have this now.
But the idea is you got to focus on the whole person. If you want to focus on the three metrics that are most important, first and foremost, you have to have people be happy. Second, you have to have them be healthy. And last but not least, they have to save money. We have to figure out how do we deliver healthcare and make it easier to stay healthy for less money.
Okay.
And the way you do that is you look at someone as a whole person, not as a bunch of silos, not as a bunch of slivers.
Okay.
And that's what's been critical. And the MyStrength acquisition, I mean, we were fortunate to be able to partner with and acquire the industry leader across the board. And I have to tell you that there's always this issue of what happens the day after you make the acquisition.
Like buyer's remorse?
Exactly. It's the meeting after, the venture capitalists call it the meeting after the investment, the first meeting. And there's been nothing but goodness. Our base of more than 700 large self-insured employers love it. The payers love it. It actually extends our payer relationships. PBMs love it. And so it's just been great. And now I'm excited for Zane to help drive it forward and build what what he built at Cerner.
All right. So what are you going to add to this?
I'll start with it. Culturally, we're very compatible, which is a really big important part when you're doing an acquisition. Will these people fit the culture? And Livongo has a fantastic culture that Glen's developed over time, and I inherit and need to keep that going. And what I really like about the MyStrength acquisition is those people are very similar to Livongo, so we're fitting together very nicely to start with. And so we've got to continue to bring those pieces together and really help the experience for people. And then we'll continue on to condition management, so you'll see us continue on that path and that journey.
Like what? What are you going to acquire next? What do you got your eye on? Whole body, whole person. Zane, you're new. Let me just break you down and you just tell me. What do you got your eye on? Any particular spaces, any regions of the body, any chronic conditions that you want to talk about?
Well, look,
okay, Master Spin is going to do it. Fine.
No, I will just tell you that, one, it's a discussion that Zane and I are having with our new Chief Financial Officer, Lee Shapiro,
Yes.
with our new President, Dr. Jennifer Schneider, and with a number of other folks around the business, and importantly, with our advisory groups from our customer base. And what
are they clamoring for? Yeah.
Well, they're looking at respiratory, they're looking at COPD, those are pretty natural. They're looking at musculoskeletal, and then they're also looking at other kinds of chronic conditions where people are struggling with, something like Crohn's or other kinds of related issues that people have on a recurring basis and struggle with over their lives. And that's what we've been able to build is an organization that creates an experience that, again, makes it easier for people to stay healthy. And that's really, so anything can apply to that in the healthcare space. But first and foremost, I think we have a big job to do, and it always starts with our member, focusing on our members and making sure that they have this incredible experience. And now with MyStrength, we can really round that out, because MyStrength isn't just about what's wrong, it's also about great stuff in terms of improving performance and all the positive, along with insomnia and along with mild depression and a whole variety of other things that people struggle with. And again, we want to get away from this disease idea and more to, it's about living life, and it's about everybody has this
Sorry
stuff.
for interrupting. I just say, it's people don't want to be defined by their condition. They actually want to forget their condition.
Right.
They want to be as healthy as possible, as close to home as they can possibly be. And really, as you think about what's natural for us to go look at the next conditions, it's going to be those things that spawn from our growth and our start in diabetes and our growth in these other areas. And what are the natural things that you put on there? But 6 in 10 adults have a chronic condition in this country. And it's amazing how hard it is for people to manage those chronic conditions. And we need to make it easier in healthcare. And that was just something I wasn't able to do in my past life, and neither was he. And now we're here together to try to fix that.
That's awesome. And here together with a group of super friends now. I mean, seriously, Captain America, what are you doing over there? I mean, so you mentioned them yourself, but you've got Dr. Jenny Schneider, who's now your new president. You've got Lee, you brought him back from another previous life, right? So Lee Shapiro, so you're CFO, right?
Yes.
So, okay, a lot of people would say that, you're building this team of super friends to scale up very quickly with some really top talent, with particular end game in sight. So, any rumors that you want to, put to bed right now about where the future of the company?
The first thing I'd say
Should I ask Zane?
You can ask Zane. I will just simply say that we are fortunate. We had a great team at Livongo. We continue to add to that team.
Yep.
And, we believe this is a very big challenge, not just in the U.S., but around the world. In 10 years, China and India will have more people with diabetes than we have people in the United States, to give you the extent of that problem. But just here in the U.S., there's so much to do. There's so many people we can help. And, we have a big vision. There's no question about it. Zane wouldn't have joined. He was running a $5+ billion revenue company. We're a little smaller than that today, but he tells me not for long. And
That's honestly how I feel about it, which is this is a bigger opportunity than what I was doing. And I know some people may look at that and say, gosh, this is, you're in a small little company, but we have an opportunity to own that interaction with the consumer. We have a responsibility to, as part of my view. And so anything else we do is going to be part of that long-term vision of how we complete the investment and how we make sure that we deliver on our promise.
Last question for you. Congratulations on becoming part of the board of the American Diabetes Association.
Well, thank you. Thank you.
And so I wanted to know, like, as far as that goes, are you taking this thinking about like holistic health there, or is that some rhetoric that they've already got pretty much ingrained into the way that they're approaching diabetes?
Well, so first of all, it's a great organization, and I'm fortunate. For many years, I served on the board of the Juvenile Diabetes Research Foundation. I'm now a chancellor there. Just joined ADA, really excited about the team they have there. They have just launched a partnership with the American Heart Association, and this guy named Lee Shapiro is on their board. And so it turns out that there's a whole bunch of folks working together to try to get these organizations focused. And at ADA in particular, I'll be focused on insulin affordability and how do we bring insulin and basic health to more Americans. And so I'm really excited about it.
No, that's so cool. And it's exciting to hear that you guys who have really like led the industry to where it is today and grown companies and exited them successfully, or they're still in business making $5 billion in revenue a year, that you guys are joining these boards and helping kind of move everybody else along in terms of collaborating and bringing down the cost of care and improving access to it. Last question for you. I want to know what you're most excited about coming up this year. I mean, you're brand new in your job. You've been given like a super team here. You've got a couple new toys in your wheelhouse, and you're expanding. So, what are you most excited about?
I'm just excited.
I'm eliminating options for you to give me as answers.
I'm actually excited. One, just to prove my value and show that I can be part of this team, because it is a great team, and I'm excited to get engaged and be part of it and really make a difference in people's lives at the end of the day. And that's what I am honestly most excited about.
Awesome. Well, cool. He sounds like a great addition. He passes my interview. Thanks so much, guys. It's always a pleasure to talk to you. Thanks for stopping by. I'm Jessica DaMassa with WTF Health here at HIMSS 19. Thanks for joining us.